Welcome back to Have More Babies, the show where we try to cut through all the noise and give you the essential info you need for your family's health. Today, we're taking a deep dive into something maybe you haven't thought about in years, mumps. I think most people assume it's gone, right? Like a thing of the past. But our sources are actually calling it the forgotten epidemic. Because it's still out there, still a real risk for kids today. We kind of need reminding why we dealt with it initially. Okay, let's unpack this then. When we say mumps, it's more than just looking uncomfortable, isn't it? What exactly is this virus doing, and why is it still considered such a big deal?
Mumps is, it's a classic, highly contagious virus. The key thing is what it targets in the body. It goes right for the salivary glands, specifically the carotid glands.
Those are the big ones near the ears, right?
Exactly, the largest ones. Located right there, front of the ears, under the jaw. The virus inflames them, makes them swell up. That's where you get that classic chipmunk cheek look. And because it's a virus and hits something so central, it just keeps circulating, especially when people are close together.
Yeah, that makes you think of schools, right? And daycares, college dorms, places you can't really avoid contact. So if it's that contagious, how does it manage to spread so well now? When we're all maybe a bit more careful about washing hands and things.
That's where its contagiousness really shines, unfortunately. The virus is just very good at getting around. We see three main ways it transmits. First, and this is the most common, saliva.
Okay.
So anytime someone infected coughs or sneezes, even just talks close by, those little droplets carry the virus.
Sharing drinks too, I bet, or utensils.
Absolutely. Think about kids sharing a water bottle or toddlers, putting the same toy in their mouth. That's a direct route.
Makes sense for spreading in a house.
Exactly. Second is direct contact with respiratory secretions from someone who's infected.
So like not just saliva, but maybe after wiping a nose or something.
Precisely. Hand-to-face contact after touching those secretions. And then there's the third way, which often catches people by surprise. Fomites.
Fomites? What are those?
Objects. Things contaminated with the virus.
Wait, so even if my kid dodges a sneeze, they could pick it up from a doorknob or a shared crayon hours later.
That's right. It really changes things, doesn't it?
Wow, yeah.
The virus can actually survive on surfaces for a bit, so everyday objects become potential infection points.
That makes places like classrooms, playgrounds, incredibly hard to manage outbreaks in.
It does. It means the virus isn't just moving person to person, but through the environment itself. Even with good air filters, surface contact is a huge factor.
Okay, so super contagious. Let's talk symptoms then. Most people just picture the swollen face. But before it gets to that really obvious stage, what else should parents be watching for? How do you tell it apart from just, a regular cold or flu?
That's a really important question because the early symptoms do look a lot like the flu. You'll likely see a fever first, often one of the initial signs. And then maybe a headache, general fatigue, feeling kind of run down, pretty non-specific stuff.
Right. Could be anything.
Exactly. But what starts to stand out is the pain linked to those glands. Even before you see major swelling, kids might complain about pain near their jaw or ear. And this pain often gets worse with really simple things like chewing or swallowing.
Okay.
So when you see that high fever plus obvious pain when the child tries to eat or drink, that really points towards the parotid glands being involved. That's when mumps should, jump up the list of possibilities.
So it's not just a regular sore throat pain. It's deeper tied to jaw movement. That's a key difference.
Yeah.
Okay, so if those specific signs, plus maybe the swelling starts appearing and a parent goes for medical help, how does the doctor actually confirm it is mumps, not something else that looks similar?
Yeah, confirmation is important. Relying only on symptoms can be tricky sometimes. It usually starts with the clinical exam. The doctor looks for that telltale swelling of the parotid glands, checks the pattern of the other symptoms too. But for a definite diagnosis, especially if there's an outbreak happening or the symptoms are a bit unusual, they need lab tests. Typically, this means blood tests. They look for specific antibodies your body makes to fight the mumps virus. If you're actively fighting it, certain antibodies, IgM, will be high.
Okay.
In some, maybe rarer cases, they might do a viral culture, take a swab from the mouth or throat to actually find and identify the mumps virus itself.
Right. So if it is confirmed, this is where it gets tricky with viruses, right? We always want to cure a pill. Is there a specific anti-mumps drug the sources mention? Or are we stuck with just letting the body fight it off?
You hit it right there. That's the tough part. There is no specific cure, no targeted antiviral medication for mumps. It's a virus, so antibiotics. Totally useless. And medicine hasn't developed a standard treatment that attacks this specific virus yet.
So what do you do then?
It all comes down to supportive care, helping the patient manage the symptoms, feel more comfortable, while their own immune system does the hard work of clearing the infection.
Okay, so what does supportive management look like practically? For a parent at home with a sick kid, what are the actual steps beyond just get some rest?
Think of it as three main pillars. First, rest. Sounds simple, but it's vital. The immune system needs all the body's energy focused on fighting the virus.
Makes sense.
Second, hydration. This is absolutely key. Fever can dehydrate you quickly, and that pain we mentioned makes swallowing hard. So pushing fluids constantly is crucial, even if it's a challenge. Dehydration makes everything worse.
Got it. Fluids are non-negotiable.
And the third pillar, pain relief. This is for comfort, obviously, but also helps reduce that inflammation. So over-the-counter stuff like ibuprofen or acetaminophen, they help with the fever, the headache, those muscle aches, and the gland pain specifically.
What about things like compresses?
Yeah, sometimes warm or cool compresses on the swollen areas can help with the local pain too. It's basically a focused effort, often for about 2 weeks, just managing comfort while the virus takes its course.
That focus on management is so important because, yeah, most kids get through it okay, but the potential complications, they sound really serious, possibly life-changing. How does mumps, which seems like just swollen glands, manage to cause trouble elsewhere in the body?
This is exactly why we say mumps is more than just a swollen face.
Yes.
Most recover fully, but the virus isn't always contained to the salivary glands. It can get into the bloodstream and travel, potentially infecting other sensitive tissues.
Like what?
The most immediate serious risks involve the brain and spinal cord. The virus can cause meningitis. That's inflammation of the membranes covering the brain and spinal cord.
Wow.
Less common, but much more severe, is encephalitis. That's inflammation of the brain itself. Now, statistically, these brain complications are rare, but their potential impact long-term neurological damage, even death. That's why mumps isn't treated lightly.
That definitely puts the risk into perspective. But there's one complication you hear about, especially concerning for teenage boys and men. It seems to carry a huge lifelong impact. Parents need to know about this one, right?
Absolutely. If we're talking lifelong health, we have to talk about orchitis.
Otitis.
It's inflammation of the testicles. It happens in a significant chunk, maybe 20% to even 50% of males who get mumps after puberty. The inflammation itself can be incredibly painful. But the real danger down the line is testicular atrophy, shrinkage of the testicles.
And that can lead to?
It can lead to infertility in males, reduced fertility, or complete infertility.
That is incredibly serious.
It is. And that specific, severe outcome is why we absolutely cannot just think of mumps as some old-fashioned childhood illness. Preventing it isn't just about avoiding a week or two of misery. It's about protecting future fertility and preventing potentially devastating neurological issues.
That level of risk leads us straight to the best tool we have against mumps, which is prevention.
Exactly. And the most powerful tool we have is the MMR vaccine.
Measles, mumps, rubella.
That's the one. The vaccine has been so successful, that's why mumps became sort of forgotten in many places. It works incredibly well. It basically teaches the body how to recognize and fight off those 3 viruses before you ever get infected naturally.
So the sources are clear. The MMR is the best defense.
Unquestionably. The MMR vaccine is the single most effective prevention method available. Getting high vaccination rates in the community, herd immunity, that's the best way to stop these complications from ever happening.
Okay, so let's bring this all together for you, the listener. We've talked about how sneakily it spreads, the specific symptoms to watch for, the fact that treatment is only supportive, and these really serious potential complications. How do we connect this knowledge to finding practical help and reliable support for your child's health?
Well, when you're dealing with something like mumps, which needs both immediate care if infected, but also long-term prevention strategies, you really need access to comprehensive pediatric support. Our source material really stresses that good pediatric care has to cover the whole spectrum. Treating acute infections like mumps, yes, but also ensuring kids are fully immunized on schedule, and supporting other wellness needs too, like lactation help or managing childhood obesity.
It's the whole picture.
Exactly. And if you happen to be looking for that kind of thorough, reliable care in Georgia, specifically around Roswell, Alpharetta, or Milton Haddon, the good news is services like that are available. Practices that really prioritize both immediate care and that long-term health plan for your child.
So if you have any concerns right now about possible mumps exposure, or maybe you just want to double check that your child's vaccinations, including MMR, are fully up to date, we strongly encourage you to seek out reliable pediatric support right away. And our main call to action today is this. Please visit omegapediatrics.com. There you can find much more detailed health information, see a full list of the pediatric services they offer, acute care, preventative care, immunizations, everything we've talked about, and you can book an appointment online. Again, that website is omegapediatrics.com.
And maybe just one final thought to leave you with, building on all this. Mumps can be pretty mild in people who are vaccinated, right? Almost unnoticeable sometimes. Yet, for the unvaccinated, it holds this potential for really serious permanent harm, like male infertility. So maybe the question for all of us is, what assumptions do we hold about herd immunity, and what's our personal responsibility in making sure diseases like mumps stay forgotten instead of making a comeback?
That's a really powerful point to consider. Okay, let's quickly recap the key takeaways. Mumps, highly contagious, spreads through saliva, contact, and contaminated objects, those fomites. Treatment is supportive care only. Complications like meningitis, encephalitis, and particularly male infertility are serious risks. And the MMR vaccine is absolutely essential for prevention. If you found this deep dive helpful, please do us a quick favor right now. Like the video, subscribe to the channel, and maybe share this video with someone else you know, another parent, a family member, anyone who needs good info on kids' health.
Thank you so much for tuning in for this important discussion today.
We appreciate you joining us. We'll catch you on the next deep dive on Have More Babies.
Goodbye for now.